Hi, my name is Chris Wadawa. I'm an orthopedic surgeon here at the Springfield Clinic in Springfield, Illinois, and this is your 2-minute drill on carpal tunnel syndrome. Carpal tunnel syndrome is compression of the median nerve, the nerve that runs down the palmar aspect of your hand and provides the feeling or sensibility to your thumb, index, long finger, and a portion of your ring finger. Patients who have carpal tunnel syndrome will complain of numbness and tingling, typically in that nerve distribution. Occasionally, the entire hand gets numb, or just some of the fingers get numb. In most, but not all cases, the numbness occurs initially at night. Patients complain of waking up at night and shaking their hands to get their feeling back in their fingertips, a motion such as this. Later, the symptoms occur during the daytime. They may occur when you're talking on the telephone, driving your car, reading the newspaper or book, or combing your hair. Typically, the symptoms are intermittent, but in later stages, the symptoms may be constant. Patients who get carpal tunnel syndrome can come from all walks of life. Some job activities are related with carpal tunnel syndrome, such as flexing the wrist for a prolonged long period of time, or putting a lot of compression through the hand with gripping. By and large, most instances of carpal tunnel syndrome, the diagnosis is not known. There are some systemic effects that can lead to carpal tunnel syndrome, such as diabetes, high blood pressure, obesity, cigarette smoking, and other conditions. The treatment for carpal tunnel syndrome is basically conservative initially. Many patients will respond to brace treatment. We use a brace similar to this that's placed over the wrist and worn at night. It allows the fingers to move, but prevents the extreme flexion or extension of the wrist that can produce the symptoms of carpal tunnel syndrome. Sometimes surgery is indicated for carpal tunnel syndrome. The surgery is very straightforward and can be done as an outpatient. Basically, the procedure is done under IV sedation. An IV is started in the opposite arm, and you're made drowsy. Once you're drowsy, an incision is drawn in your palm, right where this ink mark is in my hand. At the time of surgery, local anesthetic is placed along the incision line, and the nerve is released through the small incision. Incision is closed with stitches, and you're placed in a brace, usually for a week to 10 days after the procedure. In most cases of carpal tunnel syndrome, surgery cures the problem. There is a period of time when there may be some pain over the palm after the procedure, but by and large, the symptoms go away and the palmar pain goes away. The risks of the procedure are small, but include the risk of infection, nerve and artery damage, which is very remote, and as I said, most patients will have pain over the palm after the surgery. For more information on carpal tunnel syndrome, visit our website and click on the information Carpal Tunnel Surgery under our education platform. Thank you.